In the Philippines, where majority of the population living in poverty are situated in rural areas, the lack of sufficient health service is among the major social concerns. In 2013, only 1.89% of the country's gross domestic product was allocated to the health department, falling short of the World Health Organization's recommended budgetary allocation of 5%. The rural poor bear the brunt of such neglect to basic health rights. In some communities and regions, poor Filipinos die due to diseases that are otherwise preventable and curable, such as malaria, schistosomiasis, filariasis, and dengue, among others. This is the condition that the Advocates for Community Health intends to address. Established in December 2001 by concerned health professionals, the Advocates for Community Health, or Advocates, has since worked to enhance existing community health structures and programs by tapping all possible human, material, technical, and financial resources. In its early years, the Advocates' main resource were the committed doctors who provide health services in remote communities through medical missions and relief operations in times of calamities. It also relied on the potential of communities to address their own health situation. By 2006, the Advocates started its anti-malaria program. Malaria morbidity and mortality have alarmingly increased at that time. The program focused in capability building for communities to access the government's anti-malaria services as well as health education trainings. Several communities in 3 regions trained their own health workers. The program expanded even more in 2008 with the help of the Third World Health Aid. By the end of its first decade, the organization expanded its programs to anti-filaria, anti-schistosoma, and the mental health program, focusing on the right and access to health. Health campaigns including training and education on using mosquito nets, neem tree propagation, and use of neem products, and environmental and sanitation education were also launched. These programs paved the way for the formation of health workers' organizations and people's organizations. The community became aware of the social determinants of health. Today, the Advocates intends to expand its programs along the vision of health as the total well-being of society, where self-sufficiency and participatory decision-making exist, where people are provided equal opportunity for economic, political, and social development. Amid current health challenges and the country's vulnerability to disasters, the Advocates continues with its mission to build partnerships with communities and local and international agencies and engage in development education for people-centered health. The Advocates for Community Health will continually strive to reach out and expand to serve more communities.